Hi, Dr. Vincent. You just discussed the DREAM study with us from day 3 of ASCO. Are there any other studies that you are interested in and that you thought are useful to share with us?
Yes, Anita. So waking from the dream, we have the CORRECT study, which was an interesting end-of-line randomized trial of a Bayer drug, regorafenib, which is a multi-kinase inhibitor, especially VEGF receptors 1 through 3, and others like TIE2 and so on. These are patients who, despite being in relatively good health and from a performance status 0 and 1 point of view, had failed on chemotherapy consisting of 5-FU, irinotecan, oxaliplatin, bevacizumab, and also, if they were KRAS wild type, also an EGFR monoclonal antibody. So these are patients who would conventionally not be thought to have any options. These patients were randomized to regorafenib or placebo in a 2-to-1 ratio. And interestingly, this was a positive study, and it did show an increase in survival, a hazard ratio of about 0.73, with the median really underrepresenting that, going from about 5 to about 6.4 months, but understating the magnitude of the benefit because it really was reflected in the second part of the curve rather than the median or the first part. Also, progression-free survival. The median, again, 1.7 going up to 1.9 months. Doesn't look spectacular, but the hazard ratio of about 0.49. And the benefit, interestingly, seeming to apply right across the various subgroups without any particular differential amongst them. So this looks like it might, in principle, apply to anyone, although more data, I think, might be forthcoming with the publication. But we do know that KRAS, for example, does not seem to matter, that people who are KRAS mutated as well as KRAS wild type can enjoy a PFS as well as an overall survival benefit. In terms of the response rate, not much of an increase, but the disease control rate did seem to go up quite substantially, and of course that tends to knock on into a PFS and even a survival benefit, as one would expect. From a toxicity point of view, this drug does seem to be manageable. There are certainly issues around fatigue, diarrhea, skin rash, and a little bit of hypertension. But these all seem to be manageable in these patients who are, of course, at this point heavily pre-treated. So exactly where this drug should be incorporated and where it's going, I think, is an interesting open question right now. But certainly it was proposed at the meeting that this drug should constitute a new standard of care in patients with advanced colorectal cancer who had no further options. So whether or not the community is going to take that up, we'll just have to see.